Wide-awake anesthesia is surgery performed with no formal anesthesia. This avoids all the downsides, risks, and costs associated with regular anesthesia and is much safer for patients with health problems. Wide-awake local anesthesia is simple and requires no sedation. Patients can take anti-anxiety medication if they desire, but no sedation is required for surgery. Some of the pre-surgery benefits for patients with no sedation include no need for an EKG, chest x-rays, or preoperative blood test. No need to get undressed for surgery. No need to fast before surgery. Patients can eat and drink as normal. No painful IV placement. And a safer option for those with heart or lung problems or other medical conditions. During and after the surgery, there are further benefits including no grogginess and no side effects of anesthesia. Ability to view the surgery if the patient desires. If they do not want to, we can put a drape in place and they can listen to music or take a nap. Ability to receive and remember education about their surgery, post-operative rehab, and expected results while their surgery is being performed. Ability to actively test tendon repairs at the time of surgery to confirm good results before the patient leaves the operating room. As soon as the procedure is completed, the patient may go home and is able to drive themselves if necessary. In addition, there are decreased healthcare costs and patient expenses because there is no anesthesia charge and surgery is performed in the outpatient Cascade Surgery Center, which is less expensive and more efficient than performing the same surgery in the hospital. As the surgeon, I do the local field block and assume the responsibility. And because I need a successful block to perform the surgery, the local anesthetic field block always works. Typical surgery is performed with wide-awake local anesthesia include endoscopic carpal tunnel release. I perform approximately 99% of endoscopic carpal tunnel releases now under strict local anesthesia. Trigger finger release, quervain release, thumb arthritis surgery, most finger surgeries, olecranon bursal surgeries at the elbow. Other surgeries that can be performed this way include wrist fractures, proximal row carpectomies, and partial wrist fusions for arthritis, ulnar nerve decompression at the elbow, shortening osteotomies. Before the procedure, patients can receive anti-anxiety or relaxing medications. However, if they receive these, they cannot then drive themselves home. Injections are given using a small needle and injecting slowly, typically injecting areas that are already numb to minimize discomfort during the injection. Bicarbonate is placed in the numbing solution to buffer the normal tissue acidity and decrease the normal sting of an injection. The numbing injections are performed and allowed time to set up so they reach maximal efficacy. Typically, 5 to 30 minutes elapse and the patient is then taken to the operating room. Wide-awake local anesthesia typically provides 6 to 8 hours of complete pain relief, so there is no fear that the numbing medicine will wear off during the procedure. Sometimes, the block will provide up to 24 hours of complete pain relief. I have performed over 1,000 wide-awake surgeries with only local anesthesia with excellent results and no patients requiring a conversion to general anesthesia. For the right patient and the right indications, this can result in tremendous benefits to the patient and has resulted in tremendous healthcare savings.